Sepsis is a multi-system organ dysfunction caused by infection. And it's very, very, very important because sepsis carries a high mortality or death risk. It can affect young children, it can affect the elderly, and everyone in between. Sepsis, unlike heart attacks or strokes that come in with specific symptoms, can come in with very vague symptoms. I don't feel well. Something's bothering me. I have a fever. And these things can turn into a very, very high mortality diagnosis. People really don't know that it can become so dangerous so quickly. It's really, really important for early detection and early treatment. Sepsis detection starts usually in the emergency room. The blood cultures are obtained, and if those blood cultures are not done properly, the blood cultures can come back with an infection that the patient doesn't have.
When patients get inappropriate antibiotics because of poor guidance from blood cultures, they can potentially develop worse infections such as Clostridium difficile. SteriPath allows us to have a blood culture draw that's much more reliable and much more accurate. It allows us to identify the sickest patients and appropriately divert resources to those patients specifically.
Before SteriPath, we had the highest blood culture contamination rates, all 4 EDs. And we were over the national benchmark. As the educators from the 4 campuses, we racked our brains on trying to figure out how to lower our blood culture contamination rates, and we did everything.
When we're talking about blood culture contaminations, it's a big impact financially, it's a big impact to patient satisfaction. Nobody wants to be poked with an IV multiple times, and also for safety.
Because of the SteriPath, we had an 83% reduction in blood culture contamination rate for the 4 adult ED campuses, which took us under the national benchmark, and it had a cost savings to the system of over $640,000. We had such great results. It was like, wow. And the nurses saw, and the techs, because they draw blood cultures too, and they saw we can really help the patients and help the hospital overall. So it was really a great thing for us.